Hey y'all, we're back, Rick and Annie. And Annie, this time I found that she's got another postural distortion. She's going through lumbopelvic hip postural distortion. So in an overhead squat, I may have seen her back arch a little bit. So with the back arching, now I'm looking at it saying, okay, there's a series of things that I've got to do here. So the first thing we're going to do is I'm going to have you go through some rolling techniques for your TFL. So the TFL, if you make your body the shape of a box, it's right there in that front corner, like that front pocket. So I'm going to have you go and roll your TFL. And what she's going to do, she's going to go right to the hip. So here's the bony point in the front of your hips called the ASIS, okay? So you're going to go that bony point, and then right here is called the greater trochanter of the femur. That muscle is right in between these two bony points. Don't roll on bony points. Don't want to release those. Trying to release that muscle in between. Again, the TFL. So she's going to get that muscle released, and it's a really overactive muscle in a lot of folks. It likes to jump in there and take over because it has so many joint actions that it can do. The other thing that because she's in a hip flexed position, I'm looking at her saying, well, obviously I need to get her hip flexors released, but the major hip flexors in the body are the iliacus and the psoas major, and you cannot get through them through instrument-assisted tools because they're underneath the abdomen, and those are your major hip flexors. So we're going to get the muscles that we can get with the instruments we have. So Annie, what I'm going to have you do is now just roll. You're off the TFL, but onto the rectus femoris. Now, the rectus femoris is the major muscle that's in the quad. All right, but it's the only one that crosses the hip, and it is a hip flexor. So now she's going to roll over the quad. Gentlemen, be careful with this one. You're going to roll forward onto the quad. Nice, slow and control. You're going to find that first point of tension where you're like, that kind of hurts, and I don't want to be there. That's where I want you to be. So stay on that spot. Annie, you find a spot of contention. Excellent. Hold that position. And we're going to usually find about 2 places that you'll release. Hold for a minimum of 30 seconds, but we're going to expedite this a little bit. So Annie's now released her TFL. She's released her rectus femoris. So now we're going to move on into, after we've isolated this and we've released it with pressure, now we're going to lengthen it. So Annie, let me have you go into a stretching exercise. So we're now actually going to stretch her iliacus and her psoas. So she's going to go into a kneeling hip flexor stretch, and from the front with her, and I'm going to show you from the side what's going on. All she's doing is she's going to stand upright, and she's going to go into what's called a posterior tilt, tuck. Right? So if she's already in an anterior tilt, then part of the stretching is to do the opposite of that. What you can even do is have the client squeeze the glute a little bit, get some active stretch there. You feel a stretch right here on the front of the hip. And then you see people doing these stretches where they take the arm up, they lean to the side, and they rotate. You can do that, and that's fine if you can do that. But right now, we're just going to keep it pretty simple, and we're going to go into this stretch just in the sagittal plane. We're not going to add the frontal plane or the transverse plane. So let's assume that we've gotten a good release from Annie here. So Annie's gotten the release. Let's go into some activations. So what muscles do I need to activate if I've got a client whose back arches, and I see the back arch in an overhead squat assessment? So I'm going to go, first of all, glute activation. Secondly, core activation. So Annie, come on down. I'm going to have her go into some bridges. And bridge is a great exercise for 2 reasons. The bridge is going to be great for hip extension, get the glutes to fire. But secondly, what we're going to do is we're going to get an active stretch for the hip flexors. So we're activating the opposing muscle, and the muscle that's giving us issues is getting some more stretch to it. So Annie, belly button in. She's going to go in a neutral position. You guys can cue like this. I want you to arch your back, so stick your butt out. Tuck all the way underneath, and go right to the middle. Stay right there. Do not move from that position. Belly button in. Go ahead and squeeze your glutes before you lift and drive up. So I'm going to get her to squeeze like she's coming up from the hips. Be careful that they're not arching their back, because some clients will try to show you, look, I'm giving you what you want by coming up higher. That's not what I want. All right, so neutral position. And then when she lowers down, I want her just to lower from that hinge in the hip. All right, so it's only hip. Go ahead and lift back up. She's going to squeeze the glutes tight. She might even get a little stretch on the front of the hips. Now, some people do this. They roll the spine down. Annie, can you show us rolling down, like you drop from here and then you just kind of roll down? That is not a wrong exercise, but again, we're looking for spinal stabilization. And if the spine's moving, it's not stabilizing. So come back up. I want her to be strong in hip extension without the core movement. So think about, we're prepping her to do squats. I don't want to practice spinal rolling up and down. I only want hip movement with strong core. So go ahead and drop from the hips again. And then one more time, squeeze in the backside, drive up, and hold it right there. Do you feel a little bit of stretch on the front of the hips? That's absolutely cool. And one of the things you're going to get is you should ask your clients, do you feel it in your glutes? And you need to make sure that your clients know what muscle their glutes are, right? So, Annie, touch where you feel this on you. Glutes, right? So if she feels it here in her hamstrings, I'm going to have her move her feet towards her butt a little bit more. Once she does that, she can probably drive from the hips more, and it'll take out that hamstring overactivation. I don't mind if you feel it in your hamstrings. What I do mind is that you feel it in your hamstrings more than you feel it in your backside. That's called synergistic dominance. We got to cut that out. All right, so Annie, go ahead and lower back down. Perfect. So we've done posterior activation. Let's have you flip over. We're going to do a few planks. So she's going to go into a plank position. And in this plank, we're only going to do 3 just to show you what we're doing. Feet are hip width apart. Belly button's going to be drawn in. And Annie, I want you to lift up. I want you to squeeze your glutes tight. I want you to lock out your quads. And let's make it harder. I want you to drive your toes down into the floor. Suck in your belly button. And drop down to the knees. Relax. So we're going to do 2 more of those. Go ahead and lift back up. Everything together. Nice and strong. Abs, glutes, quads, calves. Everything's fired. Plank is in reference to a plank of wood, not the soggy spaghetti noodle planks that I'm seeing people do. We're trying to be locked out and strong. So Annie, drop down. Do 1 more super strong. Abs, glutes, quads, calves. Super tight. Squeeze, squeeze, squeeze. Nice. Go ahead and drop down. And let's get an integrated exercise in. So Annie is now going to practice in this integrated exercise activation of the glutes and activation at the core at the same time. So go ahead and take this handle, step forward. I'm going to have Annie do a reverse lunge to balance. So she's going to really work on squeezing the glutes. And then she's going to do a chest press. As she does a chest press, she's got to stabilize her core. So now we got her backside and her front side working concurrently. So Annie, go ahead, reverse lunge, that's it, and drive forward, squeeze this glute and press forward for her abdominal activation. Go ahead, reverse lunge. I'm going to be out of the way this time. Squeezing from the backside, driving forward so this backside is firing. Abs are firing super tight. 1 more time, last one. Go ahead and drive up, squeezing the glutes, keeping the abs tight. Perfect. You see she put her foot down? I'd much rather people put their foot down than hop around like a maniac. So put your foot down, get your balance again, and stabilize. It looks really good. Go ahead and let's take a break. Guys, this is a nice little exercise. Lumbopelvic hip dysfunction. If in an overhead squat you see somebody's back arch, we're going to release muscles like the TFL, the rectus femoris. We're going to stretch out the psoas. We're going to activate the glutes. We're going to activate the front of the body, so the abdominals, like the transverse abdominis, stabilize from the front. And then we're going to do an integrated exercise like a squat to press or a lunge to press, where she's activating both the glute and the abs in one exercise. So thanks so much for watching. You guys have questions, let us know. I'm Rick. This is Annie. Glad you watched.